The issues that we see sometimes with implants as they are right now is that they only come in a limited number of sizes. So when we're placing these implants, sometimes they fit and sometimes they don't. With Conformis, the implant is shaped like your own knee and it fits right every time. When we do a knee replacement, there's devices that shape the bone in order to facilitate putting in the final implant. And those devices are called jigs. With Conformis, the jigs are made for the patient, but then the ultimate implant that's put in, since it's based on that preoperative CAT scan, the implants fit the patient exactly. What a lot of companies have been doing is marketing their jigs as a patient-specific knee system. The jigs provided to the surgeon may have been made for that patient, but the ultimate implant that is put in is an off-the-shelf implant. With Conformis, the entire system from start to finish is geared and made with that patient in mind. So when we place either the femoral or tibial implants onto the patient, they just match like an extension of their own anatomy. It's dramatic. I've seen in my early outcomes things I've really never seen with traditional knees. The way that people are recovering, the way that they're having less swelling and less pain. My transfusion rate has dramatically dropped off to close to nothing. And at the end of the day, I'm seeing knees bend and straighten better and feel more like patients' own knees.